The Center for Collegiate Mental Health at Penn State University is a national and international research center and practice research network. Our mission is to bridge the gap between science and practice in the field of college student mental health. We collect de-identified data from students during the routine practice when they enter counseling services nationally. The information that we collect is used in turn to benefit our counseling center members, the public, researchers, administrators, and most importantly, the students receiving services. Back in the early 2000s, we knew that the landscape of collegiate mental health was shifting right underneath our feet. But what we didn't have was national and standardized data to help inform what was going on at the time. What happened as a consequence of that is that people that had opinions that were based on anecdotes and small-scale surveys were being used to inform policy and the narrative. Basically, what Dr. Locke did was give therapists and students a voice in what was happening with college student mental health nationally.
I've been part of the CMH from the beginning. Actually, I was even part of the team before there was such a thing as the CMH. So this was in 2005. It was this very visionary person. His name is Dr. Ben Locke. He's a clinical psychologist, therefore mostly providing treatment to college students. Would you join me? And Dr. A's and I said, yeah, where do we sign?
Dr. Locke saw the need for large-scale national data to support the mission of counseling centers. So he called a conference, and representatives from, I believe, 58 different university counseling centers came, and it was very exciting. We talked about how we were going to collect data, using what instruments, and by the end of those 2 days, we had a pretty clear vision of which instruments we were going to use, how data were going to be collected, and we've been collecting data really ever since 2010 on college student mental health and how effective psychological services are in treating problems that college students have.
Being a member of CCMH allows you to understand individually about what's happening with students when they come in for care at your center, and also gives you many tools to use at the center level to understand the macro or the holistic view of why students generally are coming in for services. This allows centers to advocate and to guide resources towards what might be needed at their center. One of the primary tools that we offer centers is called the CLI, or the Clinical Load Index. The Clinical Load Index in general is a measure of the annual caseload of clinicians at your center. The Clinical Load Index offers a way for centers to create optimal staffing levels at their centers that align with the clinical model that they're trying to implement.
The advocacy that happened as a result of CCMH has sustained us over time and really only increased our ability to advocate for our students. So we utilized CCMH data at a time where we really needed to provide more clinical care to our student population. We had brought forward some of that data to what was at that point the brand new student fee board here at Penn State University. When the Student Fee Board heard the data that we were presenting because of our relationship with CCMH and understood how critical it was that we provide more care to students, they actually increased the amount of clinician to over 10. So into the double digits, we were able to then gain more support, more resources. That kind of advocacy, I think, can only happen if you have really valuable, clear data. And that's what CCMH has been able to do for our center.
CCMH and the tools that we offer allow centers and clinicians to better understand the mental health concerns experienced by college students coming into their center. When you can understand those, it helps you better position those students for academic success.